and welcome back to Body Beautiful. I'm Janelle Marie. With us today, we are here with Dr. Joseph Mealy talking about plastic surgery, and we are going to go into our final segment, blepharoplasty.
Yes, that's the eyelids.
The eyelids. So let's go to picture number one and talk about our options for the eyelids and what you did here.
So her eyelids look pretty good before.
Yes.
She's just got some extra fullness on the top.
Okay.
So what I've done is remove some of that extra skin. And you can see a little more space between the lashes and the lid. I think it's more obvious on the far side, on her right side. You can see how that's sort of opened it up. And it makes people look less tired, more like they're paying attention, they're alert.
And such a natural look. I mean, she remains herself. A lot of people are scared it might not look like themselves after the surgery, correct?
And she can wear eye makeup better.
Oh, yeah, it's true, huh?
Because sometimes that skin runs down and grabs
That's
it.
true.
So this just cleans it up.
All right, and the scars are where?
So the scar's right in the fold.
Okay.
So it's kind of hidden. Sometimes
Very
if there's a
beautiful
lot
job.
of extra skin on the outside, I'll carry it up into the, like a smile line.
But it still goes in that line, so you really don't notice them.
It tends to hide fast.
Picture number two, and as I asked, can asymmetry be cured with an eye surgery like this?
You can usually make it better. I can't
Okay.
say it's ever perfect, but we can make it better. It depends on what the problem is. If it's extra skin, I can adjust that.
Gotcha.
If it's the opening of the eye, sometimes the muscle can be adjusted. If it's the placement of the eye, that's the bone,
you
so I can't
touch
really
it.
help that. So this lady had extra skin and
Big
fat
time.
on that lower lid, and actually she was asymmetrical. She had a lot more on this side
she
than
did?
the other
Okay.
side. So what I've done is remove a little fat from
Okay.
both sides, more on this side, and that evens it up and it gets rid of that sort of sad, heavy,
Absolutely.
tired lower
And she
eyelid
seems
bag.
like a younger woman.
Younger woman, yes.
So-
So really no reason to have that under her eye.
Absolutely not. You're way too young for that.
She has not earned it.
Can you do the uppers and lowers together?
Absolutely.
Okay.
Yeah, often we'll do them together. And we can do them under local or under anesthesia.
And what's the recovery time, let's say, if you do both of them together?
So recovery for most people, they feel good in a day or two, may
Okay.
feel like a little eye strain, so it may
Okay.
be hard to do really fine tasks with your eyes. There's some bruising, that may take a week to go away.
Picture number three.
So this is someone who, also a younger
Gorgeous.
woman, who has an indistinct fold on that right side. So she's got a double eyelid, and what I've done is just make it into a single eyelid.
Very natural.
And I've done the same on both sides because it would be very hard to make the fold low like it is on
Right.
the left. And there's a higher recurrence rate when it's a low fold.
Oh, really?
So we want about 9 millimeters in there. So with both of them up, it should stay that way for much longer.
Beautiful. Very natural. I mean, people they look the same. It's wonderful. And our final picture here?
Always the goal.
Yeah, I know.
Always the
And you
goal.
always seem to, get to that goal, Dr. Mealy.
So this lady has extra skin really on the outer part. So if you look
Okay.
at her from the side, you almost can't see her eye.
Yeah, you can't.
And then afterwards, that extra skin's lifted up. And in this case, I did put an incision sort of up to the side so I
right.
can hide that.
And real quick question, men. A lot of men are scared to get surgeries. A lot of
Sure.
them think they're not going to look the same. Do men come in for this
I
procedure?
do want them to look the same.
Yeah,
And
that's
because
true.
the eyelids, when you tighten things, it feminizes the face a little
True.
bit. So I need to pay more attention, especially in that lateral part.
Yes.
I think brow lifts cause more trouble than the
Oh, yeah.
blepharoplasty itself. But both of them, I just need to pay a little more attention for men. And we tend to have lower eyebrows, so if you leave it low, it looks normal.
All right, so guys, if they're telling you look tired, you might want to come in and see Dr. Joseph Mealy. And if you want to do that, just call the office for more information. That number is 925-943-6353, or go to drmealy.com or sanfranciscobreast.com. You can see all the before and after pictures on his website. Dr. Mealy, it's always a pleasure to have you here. Lots
Thanks
of
for
great
having me.
information. And go to cron4.com because there's the 4 things you need to know
Sure.
from Dr. Joseph Mealy. Always fun and always a pleasure, my dear.
Thank you much.
We'll see you next time on Body Beautiful. Have a wonderful day. Great information.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.